So ABACUS is a trial, it's an investigator-initiated trial. It's a trial in urothelial bladder cancer. It's a study looking at patients with potentially operable disease. Cystectomy, having your bladder removed, is the standard of care for patients with T2 to T4A, N0, M0 disease. It's a big group of patients. Essentially having your bladder removed is obviously a huge operation. The standard of care is to give neoadjuvant chemotherapy first. But about half the patients can't tolerate that chemotherapy, so they just have the cystectomy. ABACUS is a study investigating that population of patients that have just the cystectomy because they're not eligible for platinum-based therapy. And essentially what we've done is across 4 countries, we've enrolled 74 patients and we've looked at 2 cycles of atezolizumab prior to the cystectomy. Atezolizumab is a PD-L1 inhibitor. It's a drug which has a license in bladder cancer and is associated with long-term durable remission in subsets of patients. And the question we're asking is whether 2 cycles of atezolizumab can result in a pathological complete response. Also, there's an issue with getting tissue at baseline, and the cystectomy gets tissue, so we have sequential tissue. And the second question we're asking is whether or not we can show changes in immune parameters associated with the drug. So 2 key questions: can 2 cycles of atezolizumab induce complete response, and can it result in a change in biomarker expression? And the study read out, and it showed giving 2 cycles of atezolizumab is safe and easy to give. The toxicity profile is as you would expect. But the complete response rate was 29%, which was higher than we were expecting. We were expecting somewhere in the region of about 20%. Interestingly, the biomarker, PD-L1 biomarker, enriched for response. So the response rate in the biomarker positive population was 40%. In the biomarker negative population, it was 16%. So the biomarker seems to be important. It's quite a big deal for patients because having a pathological complete response suggests good activity of a relatively short period of drug in the neoadjuvant space. To underpin the results, we showed dynamic changes to the biomarker, so we can show PD-L1 expression going up with therapy, we can show CD8 expression going up with therapy, and those tumours that have had a pathological complete response, when you look at the histology, you can see infiltration of immune cells where the tumour was previously. So to summarise the results, you can show that prior to cystectomy, 2 cycles of atezolizumab is associated with a pathological complete response rate of 29%. That enriches to 40% in the biomarker positive group. We can show dynamic changes to the biomarkers. It's exciting. There's some work still to do. We need to look for long-term durable remission, so we need to look to see how the relapse rate, to see how effective this period of therapy is, number 1. And then number 2 is ultimately it would be nice to do randomised trials in the setting, showing patients not just having this pathological complete response, but actually we're curing more patients with this approach, which I suspect we will.